Hi, you're watching DNA Today, a multi-award winning genetics podcast where we explore everything to do with genetics, from CRISPR to rare diseases to new research. We have won the Science and Medicine Podcast Award for many years now. We have hundreds of episodes, and we really hope you enjoy these conversations where we dive into so many genetic concepts. I'm Kira Deneen, a certified genetic counselor and your host. So we are at ACMG, American College of Medical Genetics. It is both of our first times attending the conference, but I want to introduce everybody to Karl Krahn, who is a very, very close friend, first and foremost. And we met as students at Sarah Lawrence. We're both class of 2020, and people might recognize your voice from episode 101, like 200 episodes ago.
But happy to be here.
Long time coming for you to come back on the show. So Karl, just a bit about you and your background. You're not a patient-facing genetic counselor now. You haven't been for a few years. What do you do?
Yeah, I am a clinical analyst. I work for a clinical lab, and essentially most of my day is spent analyzing exomes and genomes and incorporating some variant interpretation and looking through exome genome testing that we offer.
Yeah, I'm always just so intrigued by that because I've done interviews about like variant curation, interpretation, kind of looking through, but it's like start to finish. I'm always so curious. I'm like, I should shadow you for a day as you work and comb through databases and everything. But yeah, certainly have a lot of admiration for being able to do all of that. But yeah, as I said, it's both of our first time ACMG. So I kind of like that we're coming together at the end of the conference. It just ended about 15 minutes ago. So we're fresh off of that, but energy is not fresh, I'll admit.
It's been a good week.
Yes, it has been. And as every recap episode of a conference, my voice is definitely not quite there. So you can tell I really did the conference, right? Talked way too much. But before we get into our favorite sessions and some that we attended together, wanted to give some listener shout outs. First and foremost to Ali, who won the very, very prestigious award, the David L. Rimorn Inspiring Excellence Award. Hopefully I pronounced that all right. That was presented at the ACMG Foundation VIP Donor Recognition Reception, which the only reason I got to attend is because we ran into each other. He's like, I'm a listener of the show and I'm getting this award, like, would you come? And so it was great. You never know what this conference is going to bring. I never have a plan going into it, really. So just shout out Ollie to be the winner there. That was very, very cool, very prestigious award. And some other listeners that I got to chat with. Just to give a shout out, and not an exhaustive list, unfortunately, because my memory at the end of the conference, everything blends together. Shout out to Haley, Kelly, Amber, Amy, Christina, Stephanie, Nathan, Jelani, Liana, Talia, Jean, Caitlin, Michelle, Alisar. I pronounced some of your names wrong, I'm sure, but it was just great. And this show can feel very one-sided because it's a lot of producing it and putting it out there and just working long hours. And I'm kind of like, okay, the downloads look nice, those numbers, but then actually to meet people that listen to the show, it's rewarding. And like, I should keep doing it, right? It's like, definitely. I'm going back, I'm tired, but so like energized in a different way. So if you ever see me at a conference, definitely come up and say hi to either of us, honestly, too. Another shout out to KGI for letting me crash their mixer for students and alumni, because I am not one. But another full circle moment was they were the first sponsor of the show. And I think it was the episode before yours, which was episode 101 about match day.
Okay.
And we now have over 80 sponsors of the show, but it's like KGI will always be the first where our mouth is. And so just will always be grateful to KGI. And I got to chat with the president, and that was very cool. But anyway, so that was kind of just my experiences of things I didn't do with you, because we did a lot of the conference together, Karl. But in terms of just your overall experience at ACMG, how did it go for you? What are your thoughts leaving the conference now?
Yeah, I really enjoyed my time at ACMG. As you said, it was my first time here. I've been to NSGC and ASHG and quite enjoyed this one. I really enjoyed the content level. As a genetic counselor, I wasn't sure the required education to get the most out of talks and discussions. And I was pleasantly surprised how applicable a lot of the content was. In my past, I worked more on the cancer side of things, but now kind of more into the exome genome testing. And there were so many talks I was able to attend and take something from. So I quite enjoyed it. And I've circled my calendar, or will circle my calendar for Baltimore of next year. So,
right? Catch us in Baltimore in March next year, 2026. Yeah, I have to say, I was a little hesitant. Will I be able to follow the sessions and what they're explaining? because we come from a genetic counseling background, we're not geneticists, we don't have PhDs. And I have to say, like, I did have to focus during some of the presentations. It wasn't like, oh yeah, totally carefree following along. Some were more like that. But others, I like definitely had to focus and be taking notes. But I was able to follow along everything that I went to, which I think that was really great. And on a nutrition standpoint, they had snacks everywhere, even like healthy snacks, which is always a plus, and alcohol, a lot of different places towards the end of the day. It was a different dynamic and vibe at the conference than I've had at other ones. And I go to a lot of conferences in the podcast space too, so not just genetics. It seems like there was a lot of obviously planning that goes into these conferences, but also planning in terms of how the attendees experience it and having coffee constantly and just snacks and those logistics that to me are very important. So what were some of your favorite sessions or something that stands out? I don't want to ask what your favorite session is because that seems like a lot of pressure.
Yeah, there were many good ones to choose from. I really just enjoyed the opening session. It kind of set the stage. I thought, well, we're in LA. The first talk was about I have his name here, Dr. Wayne Grody is a UCLA geneticist, but also a Hollywood consultant. So he talked about his roles.
That's the one you mentioned to me that I got to look up.
It's essentially his roles in film and television and being the scientific consultant. This is fascinating. So it was a great LA Hollywood start to things. So I enjoyed that.
Yeah, I wish I could have attended that one. I think I was flying while it was happening, right? Yeah. Should have gotten here the night before. But it's tough to know because when you book your flights, you don't have the full rundown of when each talk is, which understandable because they're still figuring out the schedule. So that's certainly not a critique at all. It's more that, maybe I should just come and not be flying while it's starting. Yes, but I'll have to watch that one on demand. Obviously, have not had time to do that yet. But that's what coming back Monday is for, I think, for me.
Yeah.
And is that the one that Laura Hersher spoke at too?
Yeah.
Laura is super passionate. She's been on the show many times. We'll link to that in the show notes. Mostly episodes about abortion law. Whenever there's a big update, we kind of end up texting each other like, when are we recording? It's kind of an unspoken rule, which I really like with Laura. But yeah, I'm sure she really brought to the table her experience and perspective on the politics that's happening in America. And you're Canadian. I think we have to say that as a sort of disclaimer, but that you have a different perspective, that you work for an American company, but you live in Canada and you're a thorough Canadian.
Yes. But I am concerned though about the American system, and right now it still affects me. So Laura's speaking truth to power was encouraging, exciting to hear her take. She definitely used a scientific perspective and talked about the unscientific methods and ideas that current people in power have. It was a really important way to start the conference. She received a very large ovation, the largest one I've heard of the week. And I think people respected the viewpoint. And she started it saying she has no financial disclosures, but some emotional disclosures. And I thought
that's so Laura Hersher.
It was very Laura. And she just went on and went off essentially on it. And it was, I would encourage you to hear that one as well.
And that's what's on everyone's minds right now, that there's been a lot that has happened, particularly this week while we've been at the conference. At ACMG, when I was there in Denver, it was during the week of the election. I think I got there the second day, but I was with family in Denver that week. And just going there like the night after the election, it's just interesting the timing of these conferences right now, and that so much is happening, I think, particularly at the NIH, that is just in government in general. It's certainly something that I'm glad it's not the elephant in the room and that it has been addressed in multiple sessions. Sometimes it's a comment in a session, like a couple that we've been at. My favorite session was Challenge the Experts. I didn't go to that one. Yeah, so this was to set the scene. It was Friday night at 5:30, LA. So for people to attend this, like, you've got to really bring it for people to go. And I'm thinking, it'll be really sparse, right? No, it was packed. It was packed. And the way this works, and the only reason I went to it is because my friend Jamie Duncan, who's also a genetic counselor, I said, what session are you going to? You're like, you have to go to this one. I said, okay, done. I'll attend this one. And so there is a panel of experts. I believe everybody was certainly a doctor, and people would present about 15 minutes a case, and they'd be like, okay, here's the beginning information. And then they'd pause and be like, okay, thoughts, like, what is your differential diagnosis at this point? The panel has not been privy to this information. So nice. They're learning it in real time. So they're like, all right, so I'm thinking this, and you get to hear their thought process. And they're like, well, I see that there's a difference in the hand development, and we're seeing this with a cystic hygroma or like whatever it is. And they're like, I'm piecing together, but I don't see this part. And it was also really funny because sometimes they're like, I don't know. Or like, and they're like, oh, the person presented the case to be like, what genetic testing would you order? And they're like, I don't know, what did you order? And so it was a very appropriate one for like end of the week, even though the conference ended today, Saturday. It was a riot.
Nice. Because actually, that was very essentially similar to one talk I did. I don't think you were at that one on Wednesday, Thursday, and it was like undiagnosed rare disease talk.
Okay, I saw it on the schedule.
Okay, yeah, it wasn't the same as like presenting your case, but they presented their cases, but it wasn't as much of a what are you thinking talk.
Right.
But still, some people, I was fascinated by the fact that some people like, here is the answer that we found. One person had a diagnosis of both spinocerebellar ataxia type 8 and juvenile Huntington's, like 2 repeat disorders, which was, no one really saw that coming.
Not just a dual diagnosis, but dual diagnosis repeat disorders.
Yeah, so that was surprising and interesting. And then another person, though, they presented and essentially they just left it up to the room and says, we don't have an answer. What are people thinking? It was fascinating in one sense. And also, I just appreciated the humility people had, because sometimes you can go to places and people can be a little egotistical on their ideas and what they're thinking. And it was just nice to hear people say, we don't know. Does anyone in this room know? And some people had some ideas, and you could tell they were taking notes on like, oh, we should run some certain tests that we weren't doing before. So yeah, I quite enjoyed those talks.
Yeah. This one, they were also, I won't give it away for people that might be able to watch the on-demand, because that certainly is one to watch. It was all prenatal and peds, which makes sense because those are like the diagnostic odysseys and figuring out what's going on. But shout out to the two, there were many panelists on there of experts, but two in particular really stuck out to me in terms of just, I mean, they were hilarious, number one, but more importantly, just so wicked smart. I'm not Massachusetts based, but I try it out sometimes. So Dr. Cynthia Curry and Dr. Deborah Krauko, hopefully I'm pronouncing names right, particularly Dr. Krauko, she knew, so they basically ended up revealing what gene it was. I won't say what it was. And I guess based on the C-dot DNA, like this stuff better than I do. She was like, oh, is that in the last exon? Because I read a paper about this and it had similar, and I was like, how did she figure that out?
Exon?
Like the fact that she knew it was last exon, she cited a paper, nothing in front of her. This is just top of mind.
Right.
And multiple people in the audience I could hear, I was sitting towards the back. They were like, yes, gas. How did she know that? Like, because you see this is in field time. It was just, I don't know. A geneticist that presented from Brazil, he flew all the way from Brazil to do this presentation. And from the sense that I got, which people please comment on if you went to this, I think he discovered a new condition. I'm assuming that one, because it was so popularly attended, it's one they do every year. I hope so, because I certainly will go to that next year.
Did they all have answers to their cases in?
One was ongoing, like you mentioned.
Okay, yeah, interesting.
Yeah, but the other, there was 6 cases. One was still crowdsourcing, and then there'd be someone that went up and said, "We're working on this gene. Come see me after," or something like, "We can help you get the answer."
Wow. Active collaboration.
So
very cool.
Then there was couple of sessions we attended together. One that we went to right before Challenge the Experts was. It's called the Genetic Counseling Forum. So we saw that and we said, all right, we're going. It was about sexual and reproductive health counseling for individuals with intellectual disability. So for this session, it was different in the sense that it wasn't really focused on what genetic counselors normally have in their scope of practice. What were your thoughts attending that one and some of what we heard and learned from?
Yeah, I'm not a patient-facing genetic counselor. I was fascinated, though, with the desire for people to have resources for talking about sexual health and relationships that people with intellectual disabilities are navigating and what their support networks are trying to help them navigate. There definitely was large desire to help and to educate the providers, the caretakers, so that people have their own resources. So it was really interesting, and I liked that they had a video of
Jenny and Brian,
2 great people, and it was enjoyable to see them articulate their thoughts, their feelings. They are a married couple.
Yeah, hearing from Jenny and Brian, it was really heartwarming. So Jenny has Down syndrome. We're not sure what Brian has. It wasn't disclosed specifically, but he has some kind of intellectual disability. The audience was so enamored by them, and I think learned so much from them. It was really well done, the fact that they recorded this at a studio because Jenny has a lot of connections. We learned through the video. She even knows someone that is in, what was it, a band or something? I'm forgetting now,
yes.
Something that we were all like, wow,
yeah.
Jenny's got connections.
TV producer or something similar.
Yeah. And it was cool that all the producers left, so that for people not familiar with video production, and I dabble. So they had the cameras rolling and all of the crew stepped out so that they could just do the interview, so that they felt comfortable with the person doing the interview with them, which is a healthcare provider. I think, was she a doctor? A genetic counselor. Okay.
Safe, private studio. It was great.
Exactly. That's my point. Thank you, Karl. So it was just cool to hear about their relationship. Brought up that Jenny and Brian are married, and they certainly had a ceremony, and they're married in all the ways that matter, I think, emotionally.
Yes.
And that was a phrase that they used. But legally, they're not married. And from what they shared during the session, and I won't get the legal jargon right, but when you're married, you give up some of the supports you can get from the government, I think financially, and other types of services that a lot of people with intellectual disabilities, they have to weigh that out. What are the benefits of being legally married? And there certainly are a lot. As listeners know, I'm queer. So kind of looking at that, of there's a reason why queer people have pushed for gay marriage and all that. And there's so many benefits and things that you get from being married as opposed to like a civil partnership or other things. Being uneducated in this didn't click for me until that session. One thing that came up during the Q&A was something that you prefaced a little earlier, Karl, was that it's great for us as genetic counselors that sometimes we have an opportunity to bring something up that other healthcare providers might not. And it might not be in our scope of practice necessarily, but we might be the ones best suited to bring something up, like resources. And a big part of the talk was about sex ed and reproductive information. And that's not something that I think about that genetic counselors should have to provide for patients, but who else is? And that was a big question.
That was a bit of the flavor of the talk. It's not necessarily that should be what you're discussing on a daily basis with people, but it was definitely like, here you might be the one to start the conversation. The opportunity might be only in your court, and you might not realize that initiating of the conversation might be in your scope. Again, not saying this now needs to be a 30-minute conversation per session.
Or every session where it's like, oh, we have to talk about this aspect. We have to get informed consent on this genetic testing that it's like we need to do.
Yeah, and that was brought up by someone in the audience, and that was the response from the panel being like, you just might be the start of the conversation and have resources that maybe, again, caregiver or something could use. So,
yeah, I think especially in the peds area, which we're both not in, but being able to, especially for peds, GCs and geneticists, I'll throw them in there too, that if they're seeing patients on a yearly basis, that things change with going through puberty, when it's appropriate to start talking about sex, having age-appropriate conversations within that. And parents might really not know like where to start, as you were saying, and being able to say, hey, here is resources of a bunch of different things. And there was this great QR code. I'll provide it in the show notes, that link, so that people can say to parents, hey, this is something that might be helpful, let's say to your child that may have just gotten their period. And like, how do you navigate that conversation? Because you may navigate it different than another kid that they have that doesn't have an intellectual disability. And so I thought that was just interesting to bring up, and that's something that we could potentially include, and that, as you said, it doesn't need to be a full-blown long conversation, because timing is a problem, especially I think in pediatric sessions and prenatal, but where we only have so much time with patients and we need to prioritize what we're talking about, and we may only see patients a few times. Karl, you went to more sessions than I did. I will admit, I spend a lot of time in the exhibit hall just cutting it up, chatting with people.
Networking.
There we go. All right, you'll make me sound professional. These episodes are very, very chill, right, listeners? What's a session you went to that I didn't make, that you enjoyed?
I really enjoyed the talk on the new ACMG criteria classifications, the version 4 that will come out. It is not yet published, but they are working on it. So that was really exciting. As someone who uses ACMG criteria on an hourly basis at work, this was informative and exciting for me.
And before you dive into that, what is that criteria for people that are not as familiar?
So how we classify variants, we use a rubric, and every lab kind of has their own version of their own take on the ACMG criteria. A lot of times Richard's AL 2015 is the one referenced, And it uses a scoring system to determine if a variant goes from pathogenic to benign. So they could be a VUS, variant of uncertain significance, everything in between.
Sure.
So I use this on kind of, again, an hourly basis at work, and that's how
you had to attend this session.
Yeah, I circled it on the schedule. And it was interesting to hear from this working group, this panel, and their extensive labor they put into this. I wrote down that it's not published. It's maybe, hopefully, in a year. That was a target date that they had to get this published in like 2026.
Wow, so this is very much a preview.
Yeah, and yes, yeah. But it was a good snapshot on what they're doing. There was a lot that they communicated in that session. There's lots of decision trees that they've established, because again, before there were, as an analyst, as a variant scientist, as a genetic counselor, there are, again, scoring criteria that you apply to variants for different things, such as, is this variant seen in the population? What are the in silico predictors of this variant? Does it create nonsense mediated decay? So, things like that. So again, there's scores that you use, but this is essentially breaking down each of those categories into more decision trees. It seemed like a lot, and it was a lot, but their encouragement was that this would just have less gray in your decisions. Again, you still might end up with a variant of uncertain significance, but they want to do a better job of knowing where that really lies on that scale. And interestingly, they're going to have, the framework has low, mid, and high variants of uncertain significance.
So we're going to change the language.
Parsing out that VUS, which is...
So under VUS, there'll be more subcategories.
Yes, which is, I think, will be very helpful, because a lot of times you could have a variant of uncertain significance from a lab, but essentially it's teetering on the likely benign scenario or classification. And that's because we've seen a lot of people, but we just can't quite get it to a likely benign. But now if we have a low VUS, we know where it stands, more or less. But if we have a high VUS, then we know that we're actually teetering on the likely pathogenic classification. Which is a bit of it's a game changer in how that would work, and how I think genetic counselors would counsel patients. Again, we still want to disclose a variant of uncertain significance is not actionable. It is uncertain, but it's just really, I think it'll be really helpful. Kind of from the lab side, we can see if it's a low to high in how we see it in our resources. But for that to get drawn out a little bit, that would be very helpful. Again, this is not published. These are not, don't take my word for it. It could change drastically. But it was just, this is where they're at. And they're doing current trials they're giving essentially some variants out to people in the genetics community and asking them to classify, and seeing kind of, if they use this new framework, what do they end up at? And it was interesting. There was some consensus classifications. There were some things that were not consensus. And I think that shows just the art and the science of it all, which I think is why I enjoy what I do. It is not always a binary. There's a little give and take, and there's feels. And as we don't want things to be based off of feels in classifying variants, because this is very important scientific work, but there's still just an interesting...
Everyone has their own workflow, and by that, I mean every lab has their own workflow.
Exactly. So we're really trying to not have discrepancies. That's the last thing we want, is discrepancies amongst labs. So they are doing a very good job, and a very honorable job to see where it goes. And I think, did I have any more notes on this?
So that's interesting, because as someone that's still patient facing in prenatal, when I do get a VUS, that would be helpful in thinking it through to know which way are we swaying, because I am going to counsel them a little bit differently with that, but still knowing this is a VUS, that is part of it. But I think it is such an issue right now that labs can say different things, that they can, one lab A can say this is likely pathogenic, and lab B can say likely benign. And it depends which lab you ordered from. And some genetic counselors, in a clinic will really go all out, and they'll take what their lab that they ordered from, what they said, but then check with other labs, how do you classify it? Which I have a lot of respect for GCs that take the time to do that. And I certainly do when it comes up, because I don't have as many of those as other genetic counselors, but I can see how this is going to be very helpful.
Yeah, and what you're saying, that's a time-consuming process.
It's
an important process, but it is time-consuming, and we're all trying to acknowledge how much time it takes to do that sort of thing. But the goal would be to hopefully lessen that burden on GCs. And as you said, sometimes you can see in a lab's description of the variant, you can see a few bullets or a paragraph, and you can kind of tell, okay, this isn't problematic, or you can tell where it's leaning.
It's like the commentary from the lab.
Exactly.
Right.
But we're supposed to see a more, again, drawn out or a better understood summary. But again, one last disclaimer, this is not published. We'll see how it actually is developed, how it is published, which again could be in a year from now. And then they still, after that publishing, then a publication, they would then have a tentative timeline of a year for clinical labs to then implement it.
Yeah,
so
it can't be overnight.
It can't be overnight. This is not happening tomorrow, but I can't wait to see what this looks like. And it'll be interesting to see what they do. Again, they'll do more trials that's coming up in the next few months, it sounds like. So we'll see where it goes.
Yeah, no, that's certainly something to pay attention to and how that all changes. One session that I don't think you attended that I did, which maybe there's only one or two of those, but there was one session Wednesday afternoon right before the exhibit hall opened that I caught the end of. And, as these sessions go, there's different presentations throughout. So I saw this full presentation by Dr. Bonite, if I'm pronouncing that right. As you know, I'm not good at pronouncing names. I apologize. So her presentation was about the latest updates in infertility care. So IVF, PGT, and she specifically works in Alabama. And I don't know if you remember this, last year in 2024, there was 2 weeks where IVF could not happen in Alabama because all of these laws happened. And it was wild. Wow. We definitely covered it on the show, so I'll link to that in the show notes, probably with Laura Hersher, I'm guessing. And so she kind of just took us through like what legislation happened, how it impacted patient care, because whenever we're doing IVF, everything is very timely to the point where it's like hourly. Like if you took your injection at this time, you have to come back at this hour. And to mess up with people's fertility care had massive implications. She said it was the most stressful 2 weeks of her professional career. Understandably, right?
Yeah, very fair.
And this all started really, well, I don't know if you want to say started, but a big part of this was this lawsuit because a person got into the storage tanks at a fertility center, like a random person, and removed embryos. And as we know, they're frozen, so they're very cold, and dropped them.
Oh, goodness.
Yeah, this is real. It's not science fiction. From 6 different patients. I don't know how many embryos, but 6 different patients. So he burned his hands. Like that's how cold we're talking. Because this is what cryo, am I using the right term there? Yeah. And what ended up happening from that happened December 20th, 2020. So there was a lot happening in the world at that time. So some headlines that kind of got missed. So the next year there was a lawsuit, and because of different language, I think specifically in Alabama, which I'll link to things so people can fact check for themselves, that embryos were considered to be children. So they sued for wrongful death of a child because the embryos were lost. Wild. It went all the way to the Supreme Court within Alabama, so not the US Supreme Court. Long story short, ended up having for 2 weeks they couldn't do IVF. And now there's a lot of different language where they have to be careful not to discard embryos. So they've had to work with their storage facility and also not have patients hopefully be charged for preserving embryos that we know don't have 46 chromosomes. Or embryos that don't morphologically look okay. When they get like the AB or AA or like that kind of grading that's outside of our scope as genetics people. She also got a standing ovation. Maybe not as much as Laura Hersher because Laura Hersher gets super passionate and there was probably a lot more people at that session. But people were very much hanging on her every word. And I just really enjoyed that session. The big takeaway that she ended with was that having laws that prevent people from doing any kind of infertility care gives this suggestion that there is something bad, like putting a stigma on infertility. And we've made so much progress with that since Louisa Brown, the first baby born from IVF many decades ago at this point. And we're going backwards a little. There was terms of like, is this immoral to do things in certain ways? You're just putting more of a stigma on it. So she was really great. I'm super looking forward to attending next year's. As we mentioned, that's going to be in Baltimore. So really looking forward to that. And I don't think we mentioned NSGC is also going to be at Baltimore. I'm assuming it's the same convention center, honestly.
Probably. But yeah.
6 months apart, something like that. We'll just kind of be going back to the same place. So for people that want to go next year, back on the East Coast, and I'll certainly be at both next year unless something comes up, someone's getting married. That's the only thing I can envision not attending a conference. And then in terms of the next conference I'll be at, that's a genetics one, would be probably NSGC in Seattle. This year. At least come to the end of it, I think.
Yeah. Live close enough.
Yeah, certainly. Yeah. But Karl, thank you so much for coming on.
Thanks for having me.
Yeah, just throwing the mic on you and saying, let's go and let's chat about it. So thanks for sitting in the hot seat.
Thanks for asking me. I appreciate it. It's been fun.
Awesome. And again, so great to meet so many people through this conference, especially people that are listeners of the show. It seriously really makes my day when I get to talk with people that listen to the show, because it has been, it'll be 13 years this fall of the show.
Round of applause for
Thank
Kira.
you. Yes. It definitely reinvigorates me to keep it going and everything when I meet people that listen. Always say hi if you see me. Even interrupt if I'm talking to someone else, because I'm always talking. But yeah, thank you. Networking. Yes. All right. Thank you, Karl Krahn.
Thanks.
Thanks for watching DNA Today. To access all of our episodes, head over to dnatoday.com. We also have a lot of bonus content on there that you can enjoy. If you have any questions, comments, suggestions, guest pitches, you name it, send them in to info@dnatoday.com. We'd also really appreciate if you could take a moment to rate and review the podcast on Apple, Spotify, wherever you listen to the show. It really helps more nerds like yourself find the show. Also, if you like giveaways and other ways to connect with us, I recommend following us on social. We're at DNA Today Podcast. We also have a Patreon if you want to be the most level involved in the show. That's also at DNA Today Podcast. Thank you so much for listening and watching. Join us next time to learn and discover new advances in the world of genetics.